Good morning, friends. Before I begin, I'd like to acknowledge the traditional owners of this land where we gather and pay respect to the elders past and present and emerging. I also want to extend a very warm welcome to you, friends, on behalf of Health City, Springfield, and thank you for being part of the inaugural Health Symposium. We are honored to host this special event in a very serious way, and we are so privileged that we have some of the finest minds in health and wellness. But first, let me acknowledge Minister Cameron Dick, Minister for Health. Minister, thank you very much for coming. I know you've got a very, very, very busy schedule, but I'm glad you're here. Thank you also to our partners of this session, Dr. Shane Kelly, CEO of MATA, Jeff Grady, CEO of Avio, Susie Pern and her Oricon team, and of course my business partner, Bob Sharpless. Wonderful that you're all here. I would also like to acknowledge our great speakers and facilitators for today's session. These are the people who will drive the disruptive thinking, or rather innovative thinking, as today that Health City is all about. Health City was conceived, friends, by us with the help of Harvard Medical, with the purpose of doing something absolutely unique about taking health to a new innovative frontiers of integrated health, science and delivery in Queensland and in Australia. Health City is 52 hectares, the largest site totally dedicated to all forms of human health care in one spot. According to Harvard Medical, this is unique not only in the country, but in the world. This represents not only 40% of the land area of the Brisbane CBD, but also 50% of the built form of the Brisbane CBD, with this round about 1 million square meters we have in health here. The present cost on completion, as confirmed by Ernst & Young, is over $6 billion. And it will be a serious economic driver to the state, and the workforce is around about 12,000. As you know, the uniqueness of Health City is, it is part of Australia's newest and largest city in land area, started from scratch other than Canberra. Uniquely located adjacent to our major education city, where all forms of education is underway. With health moving at an electronic speed, especially in the areas of digital and e-health, we want to consider how we can truly enhance all forms of human health for our society. Furthermore, health and education, as you know, Minister, constitute 50% of the state and federal budgets, and with both being adjacent to each other, we have a unique experience in this country has not witnessed. It is this way of thinking that has motivated us to host this event. We want to inspire innovative thinking right across the healthcare system. We want to really share with you our expectations of what this project can be to enhance human health. We want to excite you as much as we are excited, and for you to take that excitement when you go brimming with the ideas and ways to use them. MATA Stage 1 opened last year, and Avio is well underway. Please consider this. Avio is well underway with over $1 billion, 2,500 seniors living in the biggest and most advanced campus of its kind in this country. Absolute multi-generational living in a cornerstone of Greater Springfield, which is designed as a new healthy community. It's a new healthy community to uplift human and social capital. We are very heavily committed to that. The 3 levels of government recognize us as community builders and not as developers. With as unique as what we are thinking and with very serious R&D, we hope to not only retain our tremendous brain power, some of it that is leaving this country, but hopefully will attract foreign brain power, Minister. We want to add to this human capital. With all this comes serious upskilling, training and retraining of our health professionals. And please consider this as part of today's discussion. Friends, I'm not a health professional, it's you. I'm not a health professional. But we are totally dedicated to health and wellness. Greater Springfield is the only master planned city other than Canberra. But Canberra was built by the federal government with political will and had a full fuel of tank, which is money. In 1992, when we began Springfield, we had no money and no fuel in our tank. It was innovative thinking and fierce determination to create a new city with health, education, and IT. We contracted 7,600 acres of deserted forestry with no money or influence. Just a highly innovative idea and a master plan to open up this corridor that was economically and socially depressed, Minister. You know that. Everyone thought, and they also said, you are mad. You're absolutely mad. Well, I'm used to that, but we just keep going. Today, this project has attracted over $12 billion in private and public investments. And as I said to the Minister, we are growing at over $600 million annually, and that is increasing at about 18 to 20% every year. As stated by the Premier 3 months ago, Springfield is a multi-billion-dollar contributor to the Queensland economy, Minister, and a building block of the nation. The government said as part of the approval process, we had to get an act of parliament. And when the project went to parliament, as you know, we have 89 parliamentarians, they all put their hands up and gave birth to a new city. With all this, our challenge today is to look beyond the horizon where health is going to ensure Queensland is a leader in this country and perhaps in this world. Can it be done? Of course it can be done. Greater Springfield has been disrupting the norm for 25 years, and we will continue to do that. Nothing will stop us. We will continue to disrupt the norm. They said it couldn't be done, but it is, through persistence, persistence, and persistence. The 3 Ps. Friends, the greatest breakthrough in medical and health science has come from that formula of individuals who have been persistent to break the mold. We hope we will similarly create health city from that formula. The challenge for all of us, are we going to do it? Are we going to rise up for the benefit of human society? In conclusion, I invite all of you to embrace on innovation and think outside the square and be persistent. Don't give up. Please consider walking off the beaten path, which is very crowded, and find new pathways. Let's make a difference by taking the path that is less traveled and create new futures and opportunities. I'll leave you with this saying, as you think, so you become. So think big and you'll be big. Thank you.